Well, I'm presenting next. I have some co-presenters. I have Gina from Brian King Gardens, thank you, and Nisha from Porter Lodge. We will be talking about the wellness, restorative care, and reablement in the allied health care homes. Okay, so just a little bit of a synopsis. 23 aged care homes we have, and soon we will have our 24th in May at Carlingford. We have 35 Anglicare physiotherapists and 28 physio assistants in the homes. Every year we have 3 physio workshops, and we have commenced this year our PTA, Physio Assistants Workshop, the inaugural one. So this will tell you that in January to probably October 2024, we were above the national average, and the national average was 7. But since then, we are pleased to report that we have been below the national average, which is wonderful news for all of our staff and our care homes. How did we do this? Okay, so as you can see, the falls with major injuries has decreased. Unfortunately, I can't report that it is below the national average at the moment, but falls generally, as I've said, are below the national average. But we've worked very hard at doing this. There's a correlation, as you may well know, with infections and falls. So we do look very clearly and carefully at the infection rates. And of course, we know what the infections are. We know the COVID. We know the respiratory infections, and we know the urinary tract infections, and we've heard a lot about that this morning. How do we do this? Education. Now, the Australian Commission on Safety and Quality Healthcare, Preventing Falls and Harm from Falls, were released probably about 14 months ago, and we have used that in residential care space to educate our registered nurses and our physiotherapists. We've streamlined our falls committee meetings. We have them once a month, but if there is a home that has more falls than they should have, then they're fortnightly or they can be weekly. We really look at the terms of reference. You know, when do they happen? Where do they happen? We look at the call bell response time. And when I'm looking at the data, I'm finding that the homes that have the least amount of falls usually have the best call data response time. They're low. And it's like some of the registered nurses, the care managers, are like dogs with a bone. They go, please answer that call bell. We don't want you to drop the person you're with, but really get there as soon as possible. Jenny Hewitt produced her Sunbeam program, which was progressive resisted exercises. So we last year, for 6 months, in 2 of our homes, Farrer Brown Court and Donington, we looked at that over 6 months from May till November. We looked at the short performance physical battery tests, and they are 3 sorts of tests, and we have now put them into our homes, trying to get the physiotherapists to do these tests on the residents that can do them. Not all residents can do these tests. So we look at the balance, whether people can stand without being aided by their walker in feet together, then in semi-standard tandem position, and then in tandem position. Gait speed over 3 to 4 meters. We usually do 4 meters and then 5 sit-to-stands. I also like to do that, the 5 sit-to-stands, sometimes with a blue cushion on the chair, sometimes with people using their hands, just to give that person the idea that maybe at 3 months or at 6 months when we redo the test, maybe they've improved. And what a great feeling that is. Now, from those 17 residents that we looked at, we found 11 improved their short performance physical battery tests. We found that 2 were unchanged, and we found that 4 had actually gone backwards. But can I just say, this was not a research project, so anybody could come into this cohort. So we did have 2 people with Parkinson's disease that did go backwards. We also found that 9 residents did not fall during this period. So what are we doing now? I've said before, we're trying to do our SPPB assessments where possible. We have managed to have 24 of our homes having gyms, and in 2 of the homes we have 2 floors of gyms, which is amazing. So we're trying to get people to come to us more readily. The programs are in line with the new strengthened aged care standards, and if you haven't downloaded them and you haven't got them on your desk, please put them on your desk. We're looking at wellness programs. They're the programs that people can do if they don't want to be too challenged. They could be the activities of daily living. So we often have our lifestyle group as well as our physio assistants do those programs. We've got restorative care programs, a short program that may be for people that have come from hospital, have had a fracture or have had COVID, and they are not as good as they were before. We have reablement programs, which are our strength and balance programs, and also one-to-one programs. And we have our maintenance programs, whereby people can come to our gyms when we are there, and then we can set them up on perhaps the pedals, or they can do some activities. So where to now? And you've heard a lot about this morning. We're looking at osteoporosis. Who has it? Are we putting them in hip protectors? Are they on vitamin D? Looking at the infection control, the UTIs, the respiratory infection and COVID. How can we decrease that? We're looking at residents that have 4 or more medications, and we're working very closely with the pharmacists, and more education to RNs, physios and care staff on residents with Parkinson's disease, because they are our big fallers, and sometimes they have Parkinson's disease with dementia. So that makes it even more challenging. So now I'd like Gina to stand up and present the next part.
Thank you so much, Sharon, and good afternoon to you all. I'm Gina Gill, and I'm a senior physiotherapist at Brian King Gardens in Castle Hill. I have 16 years of experience working in aged care industry. Before I start with my case study, I would like to show you what sort of programs we are offering at Brian King Gardens. It's a big facility of 170 beds with a team of 2 physios and 2 physio aides working on the weekdays. And Sharon, I'm happy to share with you that I checked with Jenny this morning, and we had only 20 falls last month in April, which was 5 falls less than the last year. Now, let's start with the case study. So this is Lalita, who came to BKG on 18th of June, 81-year-old female, transferred from a rehab center to BKG. The primary diagnosis was acute kidney infection, depression, severe back pain, knee pains, asthma, both shoulders gone with RCT, and her baseline was bed-bound with full hoist. And her goal was just to stay in bed, do nothing. So the very next day, 2 of the physios we tried at different time of the day to assess her with not much success. So what we did after that, for the next 2 months, we kept going to her to give her bed exercises, to give her TheraBands, heat packs, just to pamper her a little bit, to see if she's able and she's ready to do some exercises with us. And in that 2 months' time, there was no hope. She didn't want to do any exercises. Then we thought maybe we approach it differently. So we involved the next of kin, the family. So her daughter Diane, she was involved in August, and she brought a recliner from home for her mum to sit out of the bed in a chair and have lunch. So she agreed to sit out of bed, and then after that she said never again. So after that, in September, we walked Lalita inside her room using knee braces on both the knees and using a forearm support frame with 2 physios. And during that period, we took the opportunity and we liaised with the staff, and we started using stand-up lifter for her to get out of the bed. And she started having shower once a week. In January 2025, Lalita was walking 100 meters using forearm support frame and 2 physios. And that was a big achievement. By October, she was actually doing step transfer with staff from bed to a wheelchair. So today, after 20 physio sessions and 43 physio aid sessions, you can see Lalita sitting at a salon on Tuesday mornings, attending dance concerts, bingo, hymn singing, and her name is on the resident action board sharing duties. Another observation, very interesting fact, we noticed that was the weight at the time of the admission. She was quite underweight with the BMI of only 18, as you can see in the photo with the forearm support frame. And her current weight is healthy BMI 23 with a weight of 58 kilograms. So I'll just quickly show you the next video. Just to give you an idea the distance she is walking. Her room is right at the end of the corridor. You raise me up so I can stand on my raise me up. All right. Just a small testimony shared by her daughter, Deanne.
Have improved a lot.
She really has. And for me, the biggest thing that I notice is mum's mental health has improved because I think she's getting out and she's just more agile now.
Active.
She was in bed all the time. She was depressed. She was unhappy. The other thing I also noticed is mum's looking so much weller because I think she's gaining muscle mass again now, and she's put on some weight. She's eating better. And just feels like socializing more. So it's just been really good for her.
I have to cut it down here. Now, I have a quote that normally people say it takes a village to raise a child. I say not just children, but also the old people in the aged care homes. And that's another example where one of my residents, she started walking with the forearm support frame, had a fall, and she started walking again. And now she's walking with staff. And this is just some pictures from our strength and balance class, different set of exercises for people with different goals who go out for exercises and outings. They do different exercises. So thank you so much, and I'll pass it on to Nisha.
So only 3 minutes left for me. So I'll put my fastest mode possible. Yeah. So hello everyone, that was great work, Gina. And my name is Nisha, and I'm a physiotherapist at one of our Anglicare home at Port Lodge, Minto. So I'm going to present one of the case scenario as well, like Gina. So my case scenario is completely bedbound resident who has come to our facility after spending almost 6 months at hospital and a period of a rehab as well. So just to give a little background about the lovely lady, Joanne Frost. So she was diagnosed in August last year with metastatic T6 metastatic tumor plus spinal cord compression after recurrent falls. She underwent spinal decompression, complete spinal decompression surgery plus removal of tumor on 28th of August, followed by 11 rounds of radiation therapy. So post-surgery, she developed complete paraplegia. So there was complete loss of sensation from waist down. And plus, there was a complete loss of lower limb function and bladder function. So she was discharged from for further rehab on 6th of November, where she stayed for further rehab, but she didn't make much progress. And she was admitted to Port Lodge finally on 28th of January this year. So she has been in our care for last 3 months. So her initial presentation when she was admitted at Port Lodge, so she is essentially bedbound, and she needed 2 assist hoist transfers and needed 1 assist tilt in space chair mobility for wheelchair, and could only sit short duration of time because her trunk control and sitting balance was very, very poor. If you hear in her own words, she will just feel like a pendulum which is swaying side to side. So she had only flicker of contraction in left quad muscles and some movement in right quads. There was no sensation in lower limbs whatsoever, and her goal was that she was wanting to initiate some exercises for the lower limb so that she can get some function or some movement back in her legs, because she has been essentially bedbound for last 6 months. Okay, so moving forward, the intervention we placed. So when she came in, so we increased her civic, so sitting out of bed time in tilt-in space wheelchair under supervised area. And we provided her some lower limb exercises to be completed in the bed with assistance of family. She started her gym exercises with us in the first week of February. So we started on a motor med. If you can see in the picture, she is doing the motor med exercises, which is passive exercises for the lower limb. And we also started some knee extension strengthening exercises. She also started doing sit to stand and standing balance training on Sarah Plus lifter. So Sarah Plus is stand-up lifter from Marjo with the forearm support platform. Sorry, I'm nervous now. Yeah, so initially it was very challenging because she has no sensation in her legs, no proprioception. She can't feel. So we were her eyes when she was trying to do it because she cannot feel what is happening down there. So even if she is collapsing on her knees or her feet is moving, she cannot feel it. So we had to do very vigilant training with 3 to 4 assists in the start. So initially it was just halfway raising her up and down, which is a passive lifting. And then we had to, okay, I'm moving. Yeah, okay. So also we started, once her standing balance improved, we started doing the training practice as well. 1, 2, 3. So if you see here, so it's only halfway raising 1, here. 2, 3, and 4 seconds. Here you can see a fair bit of standing balance there. So she could hold her position, but still it is a passive raising with the stand-up lifter there. So moving. I have a big video, sorry about that. So here you can see that she can support her balance pretty well, and it is like she is actively controlling here. It's not passive lifting. I have just set up a forearm support platform there, and she is raising herself on that, and she's pretty upright and she's sitting down by herself now. And she has started doing some heel raises there as well. So here she can't feel that she's lifting her heels. So I'm sitting down and coming down. Alright. Down, with them. So all my arms have become right. And now, if you can see, I have removed the heel pad as well. So she's controlling her knee by herself as well. So she's putting more effort in. I know it's going. And now the best part, she has started sitting without any support as well. So she's sitting by herself and she has gained good control on her knee muscles that she can raise her right knee completely. And now she's working good in the left side as well. And further, she is able to do some sitting balance control. So she's bending down, going sideways. And in the end of the video, you'll see she's standing up on a forearm support frame as well. So as I said, like she has spent like 6 months all bedbound because of her medical complications as well. But now achieving so far is her Reablement, and she has visited her home for the first time after 8 months for her wedding anniversary as well. So yeah, sorry, it was just very
Thank you. Okay. Thanks. Thank you very much to Nisha and Gina.